Emergencies don't wait. For the moment chaos strikes, you need life-saving essentials in your back pocket. This video unpacks the must-know first aid moves, from improvising splints with limited resources to handling seizures, fevers, and auto-injector saves that could literally be the difference between panic and survival. Every year, approximately 2,000 people suffer spinal injuries because bystanders moved them the wrong way. Most people instinctively try to sit the person up or lift them, but this can cause more harm. Step 1. Check for breathing and responsiveness before moving them at all. Step 2. Support the head and neck, never twist or bend it, to prevent spinal injury. Step 3. Use a firm, flat surface like a backboard to keep the body straight and stable. Only 10% of people know how to immobilize someone properly before moving them, and it can make all the difference. Could you help save a life in an emergency? Tag someone who needs to know this now. Every year, hundreds of thousands of people in the US are stung by insects, and most of them make a mistake that could double their pain. Putting ice directly on a sting might feel good, but it can actually make swelling worse by constricting blood vessels. Instead, apply a cold compress, not ice, for 10 minutes to reduce pain and swelling safely. Take an over-the-counter antihistamine like Benadryl. It may help reduce symptoms for many people, and no matter how itches, don't scratch. It can double the risk of infection. Here's the surprising part. Applying honey within 5 minutes can reduce redness and healing time by up to 30%. And if the swelling spreads or they feel dizzy, call 911 immediately. You just learned how to treat a sting the right way. Every year, over 1 million people suffer preventable infections from wounds that weren't cleaned properly. But you can stop it with just 2 things. Most people just rinse a wound with whatever water they have, but that's not enough. You need to clean it properly to avoid infection. First, gently wash the wound with soap and water for at least 30 seconds. This removes harmful bacteria and dirt. If you don't have soap, use a cloth dipped in vinegar or lemon juice. Both have natural antibacterial properties. Use clean water, even from a filtered stream, to rinse the wound. This can reduce infection risk by 60%. Believe it or not, you can even use a clean soda can to pour water over the wound. It gives you better control than your hand. This simple trick can prevent serious infection, and it's something you can do anywhere, with just what you have on hand. Tag someone who needs to see this, and comment your favorite first aid tip below. Every year, over 1 million children are rushed to the ER with fevers, and most parents use the wrong method to cool them down. Putting ice on a child's skin can actually make their fever worse. It triggers shivering, which raises body temperature. The right way: use lukewarm water and a damp cloth to gently sponge the neck, armpits, and groin, where major blood vessels are close to the skin. This method can help lower a child's temperature over the course of 20 to 30 minutes, safely and effectively. Keep the room cool and dress the child in light clothing. Bundling up or using cold water can shock the body. The American Academy of Pediatrics defines a fever as a temperature over 100.4 degrees Fahrenheit. And if the fever lasts more than 24 hours or is accompanied by a rash, call your doctor, or 911 if the child is unresponsive. Next time your child runs a high fever, skip the ice and do what really works. Tag someone who needs to see this, and comment your favorite first aid tip below. Every year, approximately 1,500 people die from severe allergic reactions in the US. Most people just wait it out, but that can be deadly. Every second counts when it comes to anaphylaxis. Step 1. Take an over-the-counter antihistamine like Benadryl as soon as you notice symptoms like hives or swelling. Step 2. Take the pill with water. It can start working in as little as 15 to 30 minutes if taken early. If symptoms don't improve in 10 minutes, or if breathing becomes difficult, call 911 immediately. Here's the surprising part: even if you feel fine, taking an antihistamine after exposure can help manage symptoms, but it does not stop a delayed reaction up to 12 hours later. And scientists still can't explain why it works so well in some cases, but it does. Share this life-saving tip with someone who needs it. Every year, approximately 1.2 million people in the US have a seizure, and most of us don't know how to help. Putting your fingers in their mouth can break teeth or block their airway, and restraint can increase injury risk by 30%. The first step is to clear the area, gently move objects away and stay calm. Next, gently roll them onto their side. This keeps their airway clear and prevents choking. Call 911 if the seizure lasts more than 5 minutes, or if it's their first one. Approximately 10% of seizures last longer than 5 minutes. Quick action can make all the difference. And here's the kicker: the best thing you can do is stay calm and let the body do the work. Do you know what to do in an emergency? Tag someone who needs to see this, and comment your next first aid tip. Did you know that 1 in 3 people can't use an EpiPen correctly, even after reading the instructions? In a real emergency, most people forget to remove the safety cap, and that's the first step to saving a life. Step 1. Remove the safety cap. It's the red or yellow cover at the top. Don't skip this or you won't be able to inject. Next, inject into the outer thigh, not the arm or the back of the leg. Press firmly and hold it in place for 3 seconds. After injecting, call 911 immediately. Even if the person starts feeling better, they still need emergency care. And here's the shocking part: even trained nurses get this wrong about 40% of the time. Practice really does make perfect. Do you know what to do in an emergency? Tag someone who needs to learn this life-saving move. Every year, wrist fractures are among the most common upper extremity injuries, though exact numbers vary by year and population trends. Most people try to move the wrist or use soft materials like pillows, but that can make the injury worse. Step 1. Find a rigid object, like a ruler, book, or even a rolled magazine, to stabilize the wrist. Step 2. Wrap the splint with a soft cloth or towel to protect the skin and keep it in place. If you're in a pinch, a soda can work too. It's rigid and easy to find in an emergency. Immobilizing the wrist in the correct position can improve functional outcomes and reduce complications such as pain and the need for surgery. And here's the kicker: you can temporarily stabilize a broken wrist using a rigid object like a soda can and a towel to prevent further injury until professional help is available. Do you know someone who needs this tip? Did you know low blood sugar can cause someone to lose consciousness if not treated, and you don't need candy to fix it? Most people reach for a candy bar, but sugar alone can cause a crash later. The right move: 15 to 30 grams of fast-acting carbohydrates, depending on the severity of the low. 4 ounces of juice, 1 slice of bread, or a small handful of pretzels can raise blood sugar fast, just like a glucose tablet. And here's something surprising: a spoonful of honey or a cube of gelatin can work in a pinch, too. If the person is confused, shaking, or losing consciousness, call 911 immediately. Time is critical. According to the American Diabetes Association, acting fast can prevent serious complications and save a life. Next time someone acts out of it, you'll know exactly what to do, and it's not just a candy bar. Every year, thousands of people die from cardiac arrest, and survival rates are significantly improved when bystanders perform effective CPR. You could be the one to change that. Most people panic and start shaking the person too hard. That's not just wrong, it can cause more harm. The correct way is to gently shake their shoulders and ask, "Are you okay?" If there's no response, you have up to 10 seconds to check for normal breathing. Look, listen, and feel, but only for up to 10 seconds. That's it. If they are not breathing normally, you must call 911 and start CPR immediately. Every minute you wait, their chance of survival drops by approximately 7 to 10%. According to the American Heart Association, if CPR is started within 1 minute of collapse, survival rates can be significantly improved, though exact rates vary depending on the situation. But after 10 minutes, less than 5%. And here's the kicker, if you're ever in doubt, trust your instincts. Better to act and be wrong than to do nothing at all. Do you know CPR? Tag someone who needs to see this. What's the first aid tip you want to learn next? Every year, many people experience a severe sugar crash, and knowing how to respond can help prevent complications. Most people try to give them water or a snack, but that won't raise blood sugar fast enough. Instead, give them 15 grams of fast-acting sugar, like 3 to 4 glucose tablets, or about 4 to 6 ounces of juice. Wait 15 minutes. If there's no improvement, call emergency services immediately. Did you know diabetic alert dogs can detect a sugar drop using their sense of smell? Knowing how to respond could make the difference between recovery and a life-threatening emergency. And scientists are still researching how these dogs detect such subtle changes in scent. Every year, hundreds of thousands of people suffer broken arms, and many are left in agony because of one simple mistake. Most people instinctively try to hold the arm straight, but that can actually increase pain and risk further injury. Using a soft cloth or folded shirt can help create a comfortable pad for the arm. Wrap the shirt around the arm and body, securing it with a belt or scarf to keep the arm steady. This properly made sling can reduce pain by up to 75% and keep the arm stable for at least 4 hours. And here's the best part, you can create a functional sling in under 30 seconds, no medical training required. And scientists still can't explain why it's this effective, but it works. Know someone who needs this tip. Tag them now. Every year, over 50 million Americans experience minor allergic reactions, but few know the right way to treat them. Most people just ignore it, but doing nothing can let the reaction worsen quickly. Step 1. Apply a cold compress for 10 minutes to reduce swelling and itching. Step 2. Take an over-the-counter antihistamine like Benadryl within 30 minutes to stop the reaction from getting worse. Step 3. Elevate the affected area. It can reduce swelling by up to 30% in under an hour. According to the American College of Allergy, Asthma and Immunology, acting fast can prevent a minor reaction from turning serious. And if symptoms like difficulty breathing or swelling of the face occur, call 911 immediately. Do you know how to treat an allergic reaction? Tag someone who needs to know this now. Every year, over 1 million people visit the ER with head injuries, and many of them could have been stabilized with something you already have at home. Most people try to move or adjust the injured person's head, but this can actually make brain damage worse by up to 30%. Here's what to do. Wrap a pillow in a towel to create a soft, stable support for the head. Place the pillow under the person's head and use a belt or scarf to secure it in place, no medical gear needed. Call 911 immediately if the person is unconscious, vomiting, or has slurred speech. These are red flags for serious injury. Quick stabilization of the head may help some head injury patients, but there is no clear evidence of a 20% improvement rate. And the best part? You don't need any training, just a pillow, a towel, and a belt. Could you save a life with what's in your home right now?